Hi, everyone. My name is Kennedy Cole, and I'm the Outreach Coordinator for the Center for Urban and Regional Analysis at The Ohio State University. I'm excited to welcome you to our first webinar in the series, Cities for All, Creating Communities that can be accessed and enjoyed by everyone. This series is co-sponsored by Cura, the Age-Friendly Innovation Center, and the United Way of Central Ohio. Throughout this series, speakers from various fields will discuss how cities can approach urban planning in a way that prioritizes serving the diverse needs of residents. Today, Dr. Léa Ravensbergen will explore how gender shapes everyday mobility experiences, drawing on examples from pedestrian, cycling, transit, and driving research. She will then delve into a root of this problem, the gendered biases embedded in transport data collection. Before we introduce Léa, I want to mention a few logistical items. If you require closed captioning today, you'll find a box at the bottom of the screen labeled with CC. Click the box and select Show Subtitles. This will allow you to view subtitles during the presentation. During the webinar, feel free to submit questions at any time using the Q&A box. We will ask as many of your questions as we can in the last portion of the presentation, and if we don't get to your question, apologies in advance. Chat has been disabled, so please use the Q&A if you have any information to share with the organizers. As you may have seen on our website, this event is approved for one AICP CM credit. To claim your CM credits, log into your My APA account on the APA website and enter the event into your online CM event log. There will be a brief survey at the end of the webinar. If you have time, we encourage you to provide your feedback to improve these events. If you have any additional questions following this event, please don't hesitate to email us at cura@osu.edu. To learn more about Cura's future events or sign up for our monthly newsletter, visit cura.osu.edu. You can learn more about Age-Friendly Innovation Center at the agefriendly.osu.edu and United Way of Central Ohio at liveunitedcentralohio.org. Now, I'd like to turn things over to Harvey Miller, Director of the Center for Urban and Regional Analysis, who will introduce you to our speaker.
Okay, thank you, Kennedy, and thank you all for joining us today. I'm really excited about today's talk and about this series we have this semester on Cities for All, making cities more inclusive so they can be accessed and enjoyed by everyone. So I have the honor today of introducing our speaker, Dr. Léa Ravensbergen. She is an assistant professor in the School of Earth, Environmental, and Society at McMaster University. Her research explores how cities can foster more sustainable transport systems in an equitable manner. She uses a combination of methods, qualitative interviews, mobile ethnography, participatory mapping and observations, and also quantitative methods, surveys, analysis, and GIS, to uncover barriers to walking, cycling, and public transit. Much of her recent work has focused on gender equity in active travel and age-friendly transportation planning. Dr. Ravensbergen earned her undergraduate degree in environmental science at McGill University and her master's and PhD in human geography at the University of Toronto. And now I'll turn the floor over to you. Please, Léa, floor is
Thank
yours.
you. Yeah. All right. Can everyone hear me? Thank you so much for that introduction, and thank you for inviting me to speak today. It's a real honor to contribute, even in this small way, to this really wonderful series and to the Center of Urban and Regional Analysis at The Ohio State University. Now, full disclosure, I'm a big nerd when it comes to gender and transportation planning. I'm obsessed with the topic, and it's always very exciting to know that I have a captive audience for 40 to 45 minutes. So it's very exciting to be speaking here today. Sorry. One of the reasons why I love this topic so much is that unlike other things that I study, people often don't realize that there are gender differences in transportation. I'll often get comments from my students, my peers, and my friends and family that are surprised when they hear that the experience of moving through a city is gendered in many ways. And yet we've known this for a long time. Up on the slide here now, I have just two examples of kind of key works that came out of the 1970s, arguing that we needed to have a gender lens in transportation planning and research. 70s was quite a while ago now, and a lot of the things that were argued then are still relevant now. We haven't really closed a lot of those gender gaps, and people today still kind of assume that there's a neuter commuter or that these gender differences don't matter or don't think about them. So I'm here today to spend 40 to 45 minutes to show that gender really does matter when it comes to transportation research and planning. Um, so I warned you, I'm a big nerd when it comes to this topic, and I had to have a real deep think about how I was going to use this precious time. There's so many different things I wanted to delve into. And what I decided to do, and I hope I've read with the audience right, is to start off with just a broad overview of some key examples of why gender matters when it comes to transportation. So I'm going to cover key examples around gender travel experiences. So it's a lot. I'm going to jump around a lot, but hopefully you'll come out of that going, okay, you've convinced me. Gender definitely matters. We do need to consider it regardless of mode. I then want to delve into one of the reasons why I think we have some of these persistent, sticky gender differences, and that is gendered biases in data collection. And I'm going to focus in on some of my research on data collection practices around mobility of care, which is all the travel that people do to perform unpaid household labor. I'm going to end with some actionable steps, focusing mostly on mobility of care because we'll spend a lot of time on that, but also some broader ones that touch on some of those gendered travel experiences. So we're going to do a lot. Hopefully, we'll keep it exciting, and hopefully, I'll have you all telling your friends and family how important gender is in travel behavior by the end of this talk. So let's start with some overview of gendered travel experiences. I want to start off by saying that in this talk, I'm going to be talking a lot about differences between men and women because we've consistently found differences between how men and women travel. But of course, gender is more complicated than that. It's a social construct. We're oversimplifying it by considering it just according to the gender binary. There's lots of different ways of expressing gender. And of course, there's no one experience of being even a man or a woman. Most of the research, however, is focused on that binary. And I only have 40 to 45 minutes, so I could only do so much. So that's what I'm going to focus and stick to today. And overall, we do find these big differences in just travel behaviors between men and women. Key ones, if we're going to think of different travel modes, is that women consistently across populations are found to walk more and to use transit more than men. Men, on the other hand, are found to drive more and to bike more than women. Other key gender differences that exist that are consistently found are that women tend to travel shorter distances and make more frequent trips. Women are also more frequently trip chainers or exhibit trip chaining behavior. This is where you make a stop between your origin and your destination. So, for example, if I'm on my way to work and I need to drop off my child, or I'm on my way home from work and I need to pick up some groceries, that's trip chaining behavior. Of course, these are aggregate differences. Lots of women drive everywhere and never walk. Lots of men use transit lots. But overall, these are the gendered patterns that we find across populations. I'm interested in these gender differences. I think they're important. I think we need to consider them when we're planning our cities and our transportation systems. But I'm also really interested in why they exist. And I think it's important to note that a lot of these gender differences, I argue quite strongly, aren't so much about biology. They really are social differences. These are things that do not have to be that way. They are due to the way that we organize our society. Some of the reasons why men and women consistently are found to travel different include the fact that women tend to work lower wage jobs that tend to also be near the home. So that will involve shorter trips and sometimes more frequent trips. These jobs will often have flexibility so that they can do things like go home if their child's sick pretty quickly or that sort of thing. And women also tend to be responsible for more household serving labor. You're going to hear me talk about a lot of that today. Everybody performs household serving labor, like getting groceries and taking care of your children or your older dependents. However, women do tend to consistently do more of this labor than men across the world, but also specifically Canada and the United States. I'm interested in why we have these gender differences in travel behaviors, but I'm also just interested in the different experiences themselves of gender travel behaviors. An example of that is just how different it feels to be traveling if you're, for example, doing those household serving labor tasks. We can see here in just the image that I have, warning, pushing this device through a city will radicalize you. And it's a picture of a stroller. I do not have children. However, anytime I am an aunt and anytime I need to try to get my nieces and nephews through the city, I am just shocked at how hard it can be to try to navigate public transit or even the sidewalk, wrangling the kids and all of the stuff that they involve. We don't really design around care that way. We kind of design for a different experience, assuming that people are traveling on their own. Another key topic of gendered travel behavior that's really important, there's a huge body of work on this, is that safety is a mobility barrier for many women. Women consistently report greater concerns over safety, and this can influence their experience of travel, but also how they travel. Most of this work is done on women's experiences of safety using public transit, um, and how it prevents women from using public transit or it changes their experience of public transit, that concern over safety. Why are these safety concerns present? I would think it's important to note that incidences of violence on public transit are actually very low, especially for most women and especially for white women or higher income white women. By many measures, racialized men actually experience more violence on transit than white women do. So transit is safe, but then again, I'm a bus commuter, so of course I'm going to push for that reminder. However, women do experience experiences of sexual harassment on transit or other experiences that are, of course, not pleasant and unsafe, but also really make it feel like it's an unsafe transportation experience. So the safety is a really important thing to focus on if we're to encourage public transit use, especially for women. And a very different just experience that people can have on transit. I want to take some time to talk as well about cycling. I did my entire PhD research on the gender gap in cycling, so I just had to take some time on this here. Cycling is one of the transportation modes where we see actually one of the largest gender gaps in low cycling cities. And by low cycling cities, I'm talking here about all American and Canadian cities, as well as Australian and New Zealand cities, and a lot of cities in Europe and other parts of the world. We have this big gender gap in cycling where approximately 1/3 of cyclists identify as women and 2/3 identify as men. I'm a geographer, so I'm fascinated by the fact that this is a very spatial pattern. This gender gap in cycling disappears in places where you have good cycling infrastructure and lots of people cycling. So, in many cities in the Netherlands, in Denmark, and even in Germany, where you have safer cycling infrastructure, that gender gap disappears and women cycle at the same rate or sometimes even slightly higher rate than men. So, we don't have to have a gender gap in cycling. That is my goal, that is my vision. Why does this gender gap in cycling exist? Well, throughout lots of research on this topic, we have two main reasons why it exists that keep coming up again and again. The first is the safety concerns, and the second is mobility of care. In case I haven't defined it yet, mobility of care is all the travel we do for household serving labor that I've already talked about a little. So, getting your kids to school, grocery shopping, and so on. Safety concerns are really important when it comes to cycling. It's a top barrier to cycling in Canada, followed closely by weather. Um, I think many of you are in Ohio, so you also probably have what we have up in Canada, where when you tell people we need to make our cycling cities safer to encourage cycling, people go, well, no, it's just about the weather. And I go, no, 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 safety is actually more important than weather. But that's a whole other discussion. I'm happy to talk about weather with as many as you want in the question period. Safety is a top barrier to cycling for everyone, but women consistently report it as more important in their decision to bike or not. Safety influences whether people bike at all or what route choice they take. And having cycling infrastructure, having bike lanes and paths and routes has been associated with not only actual higher rates of safety, but also lower perceived concern. Um, as I said, women consistently report this as a barrier more, as a reason why they don't cycle. And there's also some really interesting observational research that has found that before you put a bike lane in, you tend to have more men cycling. And when you put a bike lane in, it gets safer, you get a higher proportion of women that start cycling as well. So safety is really important for everyone, but especially for women. But I want to go back just for a second to what I said earlier about a lot of these differences being social, not necessarily biological. I have lots of people argue with me that women have more concerns over safety because they just are that way. They just find safety more important to them. And safety was important in transit research too. Um, but some of my research, some of my qualitative research has found that a lot of the reason why women experience or express more concern over safety is also just tied to society, in that it's tied to how much experience they have with cycling in the first place. Um, So, for example, in some of my work, interviewing people who are relatively new cyclists on that experience of what it's like trying to bike in a new city, you find really big differences in terms of how concerned people are about safety if they have a lot of cycling experience and if they have less cycling experience. I have some quotes here for some of my interviewees, and you can compare what they think about cycling and safety and their confidence based on that experience. So people with a lot of experience cycling, people who've put in hours on the saddle, will say things when asked about safety like, not really, because I've ridden bicycle for many years, right? It's not much of a change. I'm okay biking. I know how to do it. I have that confidence. Or, when I was a child, I fell a lot from my bicycle. I injured my knees, my elbow, lots. It's usual for me. So I can control the bicycle in any situation, it's not hard for me. That results in a lot more confidence in cycling, having that experience, and a lot less expressions of worrying about safety. People with less experience, on the other hand, will say things like, I know how to ride a bike, but not anything further than that, really. And I really want to get really confident enough to be able to ride on the street. So that's kind of what I'm afraid of most. Or the more time I will spend on a bike, the more confident with the bike I will be. So I argue that having more experience cycling will help you feel less worried about it, and you will feel safer if you have more experience. What does this have to do with gender? Well, that access to that experience can be gendered. In that study where the quotes I just showed you were from, 53% of female participants compared to 30% of male participants reported having no or minimal experience cycling. And this was really tied to gender norms. You'd have participants tell me things like they didn't bike much as a child because it was mainly boys that would bike unless you were a tomboy. So actually, the act of cycling was sort of a resistance, and you were not performing your gender adequately. You were a tomboy if you wanted to keep biking. Or other female participants saying things like, I stopped at the age of 13 or 14, I wasn't young anymore. It wasn't appropriate for me as a woman to bike. Now, I grew up with a Dutch mom who made us bike my entire childhood. I never experienced any of those pushes to stop cycling because I'm a woman. Um, and I got lots of hours in the saddle because of my Dutch mom. And that's perhaps why, for me, when I first moved to Montreal and then Toronto, it was very easy to quickly pick up a bike and start cycling. I didn't have those safety, I mean, I have safety concerns, but not the disparity that you would expect. However, so it doesn't need to be the case that you have these gendered associations, but it is the case for a lot of people. In fact, previous work has established that boys cycle more than girls and children in many countries with low cycling rates, including Canada and the United States. And in Canada and the US as well, although I'm sorry, I've got a Canadian source here, it's those teenage years where you really see a big difference. At the age of 14 is when girls really stop and drop out of sports at much higher rates than boys do. And there are impacts on that that can shape perceptions of safety and then shape the gender gap in cycling. Okay, so safety is really important. Safety is gendered, and it can be rooted in some of those gender norms around physical activity and access to cycling experience. Another key reason why we find in the literature that women cycle less than men is because they do more of those mobility of care trips. They do more trips to drop off their kids, to pick up groceries, to get health appointments, to run errands. And we know that doing those trips by bicycle can be a barrier in low cycling cities. People say it's harder to do those types of trips. They worry more about the safety of their children if they're biking with them. They find it hard to get groceries on their bikes and so on. And we also know from survey research that travel for household surfing trips by bicycle is less common. Getting to work is a little easier by bike than doing these other mobility of care trips. We also know that parents with children use bikes differently, and this is even in places with high cycling rates. It seems like places in high cycling rates where it's the easy, convenient, safe way to get around, people will make these trips, but they will adapt to them, for instance, by getting cargo bikes or panniers or baskets or so on, or it's simply just safer for them to bike with their kids, so there's less of a deterrent there. So this changes the way we use the bicycle, this mobility of care. And in places like Canadian and American cities where we don't have a great cycling infrastructure, it can actually be a barrier for cycling, especially for women. Okay, I've covered a lot. I have one more example to show you some gender travel differences, but I know I'm kind of going quick and doing a lot of big overview work. I do want to take a minute to talk about driving. A lot less of my research is about driving. I tend to focus on sustainable travel modes. But there's really interesting differences in gender with driving as well. I know I mentioned earlier that men tend to drive more than women and to drive longer distances, but there's also really interesting gender differences when it comes to road fatalities. Road fatalities are interesting to me because we also have very much normalized them, even though their impact on public health is huge. Around 1.35 million people die every year on the world's roads, and another 20 to 50 million are seriously injured. Since motorization, which was not that long ago, over 30 million deaths have been attributed to crashes. And this is more than all of the soldiers who died in World War I and World War II combined. So this is a really big public health issue, is road fatalities. In fact, the head of the United Nations Road Safety Fund has called road violence a silent epidemic on wheels. And road fatalities are also gendered. Some people die a lot more in road fatalities than others. And that is young people, adolescents, and young adults worldwide. That's the leading cause of mortality for young people across the planet is road fatalities. But also men. I wanted to give an example where it's not just focusing on women, but it's men who die far more frequently of road fatalities than women. In Ontario, where I'm based, 70% of fatal crashes are men who are dying in them. This is found across the age spectrum, but we do feel it more strongly in those younger age categories. So this is a transportation experience that is also very much gendered in that men experience this road violence more than women do. What's extra interesting about road fatalities too, when we're thinking about gender, is it's not just that men are killed more frequently or seriously injured more frequently, but for some reason, there's this myth that persists that it's the women that are the bad drivers. I pulled this out of, pretty horrible aspects of the internet, so I apologize for putting it here again. But there's this myth that persists that women are terrible drivers, and yet it's men that are consistently involved in more crashes and dying of more crashes than women. So there's really interesting biases in what we actually see in the data and what society thinks of when it comes to road fatalities and gender. It then gets even more interesting when you think about not just who gets hurt, but who is more likely to get hurt when a crash occurs. So men might die and get injured at much higher rates in road fatalities, but when there is a crash, women are actually more likely to be injured. They're just in those crashes less often. So far, I've relied mostly on Canadian examples. I finally have some American data here, so apologies for that. So women are less likely to be in a crash, but when they are in a crash, they're actually 17% more likely than men to die, 47% more likely to be seriously injured, and 73% more likely to sustain serious injuries, specifically when it's a front end collision. So this is another really interesting twist on that gendered road fatality, where yes, when men are dying more, but when in a crash, women are more likely to die or be injured. Why is it the case that women are more likely to be injured or to die? There's a number of reasons here, and this is an emerging field of research. But part of it is that the average crash test dummy is based on the average male size, which is 5'8" and 161 pounds. The average female size is considerably smaller than that. But I also think it's important to note that that average size is also missing out on a lot of male bodies as well, who are much bigger or much smaller than that. In fact, I'm closer to the average male than probably a lot of men are in terms of weight and height. But a lot of people get missed out. A lot of people's anatomies get missed out when we use just one average, and that one average is only based off of half of the population. The first female crash test dummy was only used in 2011, which is not very long ago. Another issue is that there's no testing done on pregnant bodies. And car crashes are actually the number one cause of fetal death related to maternal trauma. We also don't yet have a seatbelt that's designed for pregnant women, but research from 2004 finds that pregnant women, 62% of third trimester pregnant women don't fit into the regular seatbelt design. So there's this kind of assumption of what kind of bodies are going to be in cars and doesn't fit a lot of people's bodies. And then there's also some really interesting biases that aren't just about size. For instance, there's research that has found that the firmness of headrests can put women at greater risk of whiplash because we don't test that firmness on women's necks and so on. Okay, So I've covered a lot there. I wanted to give you just a taste, though, of why gender matters in transportation research and planning. So we did a lot on cycling, we did a lot of road fatalities, we did a little on transit, a little on walking, to kind of give you a scope of all of the fascinating research out there. And again, so that you can finish this talk and go home and tell all your friends and families that it matters and it changes things, even if they don't necessarily think of it as something that's going to impact transportation. I do want to spend some time here digging into one of the reasons why I believe some of these gender differences are so sticky, why it's so hard to bridge that gap and to reduce those gender disparities. And this is gendered biases in data collection. I'm going to focus in here on research that I've done on mobility of care. I've talked about care a lot here, but just in case, I'm going to repeat it again. It's all that travel we do for care work, grocery shopping, escorting children, older dependents, errands. Some people include health appointments as well. And I argue in my work that care travel is often systematically undervalued, underrepresented, and underquantified in transport research and planning. Why is that the case? Because we don't really count it or we don't count it well. I'm going to try to convince you of that using some Canadian examples over the next few minutes. In Canada, we have a few ways, great ways of measuring travel. A big one that gets used is our census. It's the only data tool we have that's across the entire country. And in there, we do have questions about transportation, and every single question is about one trip, and that is the trip to work. It includes a decent amount of insight on the trip of work, including where it is, how you get there, how long it takes, what time you leave, and so on. But focusing just on that trip of work, which is the one data point we have for the whole country, does not capture those care trips because they are, by their very nature, not work, because there are the unpaid labor. Um, so when it comes to those charts that I was showing throughout my presentation, a lot of time when I'm showing gender differences, you're kind of inadvertently grabbing the commute responses because the commute is our best data, but you're not capturing all trips when you're capturing just the commute. We have more than the census, of course. Lots of different cities and regions will have large origin destination surveys. But even in these surveys, which focus on far more than the commute and are very good surveys, I'm not trying to, be too harsh on them. We still don't capture care very well. I want to give you a specific example by focusing on the Transportation Tomorrow survey, which is the origin destination survey that we have in the Toronto region. Technically, it's all of the Greater Golden Horseshoe, which is most of Ontario. And to be fair, that is where like 1 in 4 Canadians live. So it is a very big survey that really informs major policy around transportation planning in the most populated region of the country. The Transportation Tomorrow survey is quite comprehensive. It's run every 5 years since 1986, and it is, again, a great survey. However, I argue that it has some gender biases in that it doesn't well capture care. In the Transportation Tomorrow survey, the origin destination options are home, first work trip of the day, second and subsequent work trips, first school trip of the day, second and subsequent school trips, facilitate passenger, marketing/shopping, which is new since 1991, daycare, and unknown. I've been talking for a good 25 minutes now. I know I want to pause for a second to make you do an activity, and I know you can't. You're all at home and remote, but if you can grab a piece of paper or just your phone or a computer, I want you to actually think about how you would respond to this survey. Let's use yesterday, which was a weekday, and I want a weekend day. So think about your Sunday. And I want you to actually write down all of the origins and destinations of each of the trip you made on those 2 days using the TTS options. So I have on the slide all of those different days, sorry, all those different origins and destinations. And just as an example, yesterday, yesterday we had a snow day, so I didn't do this. But let's say yesterday I went to work and went grocery shopping on the way home. Then I would write, okay, I went from home to work, which is from 1 to 2. Then I went from work to shopping, which would be from work to marketing shopping, which is 7. And then I went from shopping to home, which would be from 7 back to 1 home. So I know it's a little weird over Zoom, but I'm going to give you like a full 40 seconds to do this now, because I want you to actually think of how you would respond to your survey. So I'm going to stop speaking, have a sip of water, and I'll be back in 40 seconds. But please do this. Mm. Okay, I've never done this online, so I don't have a sense of whether you've been able to do both days, but hopefully you've been able to do a little bit of those trips and see how you'd respond to them. Maybe at the end during this chat, you can share any of the ones that you found hard to categorize. I'll give you some example about how care trips can be poorly captured, though, using this survey. Maybe some of you had to drop off your child at daycare or school. Pretty common trip. Um, how do you respond to that on the TTS? It's actually surprisingly confusing. You have one that's facilitate passenger, number 6. That feels like a good one for dropping people off at daycare or school. But you also have daycare, which is 8. So I'm not really sure how people handle that and which one they respond to. You also have school trip, which I assume is just for the person responding, but you could interpret that as being a school trip for your child. So there's 3 potential options that you might respond to for dropping off your child at school or daycare. Then there's the question of grocery shopping. There is an option for grocery shopping, it's option 7. However, it says marketing/shopping. And that to me is going to capture trips for groceries as well as trips for shopping for leisure. Nothing against shopping for leisure. It's great. It's very important. But I think it's a very different type of trip to plan for. If I'm shopping for leisure, I don't think I'm carrying as many bags of things. And I don't think I'm handling it the same way. I hate shopping, but it's still like a fun trip compared to grocery shopping, which is an essential trip that I have to do quite a bit more regularly than shopping for leisure. And we don't differentiate between those two. What about if you're visiting an older relative to help them clean their home? I honestly think on this survey, I would just write unknown. A lot of surveys will have leisure at least. That's not really a leisure trip because it is a care trip, but it probably gets categorized that way. And if you want to go to a hospital appointment, which is also a care trip, we also don't have that as a category in the TTS. So I hope you had similar examples. If you didn't, maybe you did less care over those days, or you got some of those care trips that are captured better. When I do this with my class and teaching, I also have come to realize that undergraduate students don't really fit the TTS categories very well, and not necessarily because they have a lot of care work, but for other reasons. My point here is that a lot of trips are hard to capture using these origin destination surveys. And yes, they're all a little bit different. Some of them aren't captured well. And the mobility of care in particular can be poorly captured in these important surveys. In these examples that I just showed you, the TTS at least will admit mobility of care by either not capturing it, a lot of those trips will fall into the unknown category, or capturing it poorly, where trips like, for example, shopping for leisure or shopping for groceries get thrown into the same category, even though I would argue they are different trips. Not included in that example are other ways in which mobility of care trips can be poorly captured. They can be too short, so they get completely, we can have a data practice where we just don't include trips that are too close to the home or too short. Or if they're part of a trip chain, like I mentioned, if you do it on your way home from somewhere, sometimes it's hard to capture those in our analyses as well, and those trips get omitted. Moving on to Montreal is a different city that uses a different survey, so you'll notice the categories are slightly different. I've done work where I've actually tried to recategorize the mobility of care, the options to capture how many trips are mobility of care in Montreal. And what I found, focusing on adults, to be fair, is that mobility of care actually comprise a huge proportion of people's daily mobility. In the Montreal example, we found that 28% of adults' daily trips are for care purposes. And I think this is important. If we, work for the city of Montreal or the transit agencies in Montreal, and we're looking at our data, and it's good data, it's origin destination data, this is what you think is important. If you look at the graph on the slide here, you go like half of the trips are for work. After that, what's important is pickup and then shopping and leisure. But it really feels like the trip to work is the most important trip. And it is the most important trip that we do most frequently. But if you combine all of those care trips, you'll see that 28% of them are an important part of people's day that we aren't necessarily thinking of, or we don't see just how important it is because of the way that we categorize and measure our data. Um, And these are important. This chart here shows in orange the proportion of of women's trips for each trip, and in blue that of men's. And I probably won't be a surprise to you now because I've said it so many times, but women really do have a higher proportion of their trips as mobility of care than men, 32% compared to 25%. So it is a more important trip for women. And it's also more important for women in an intersectional way. Unfortunately, in Montreal, they actually don't capture a lot of socioeconomic variables, but one thing they do ask about is people's income. And we find, looking at this graph here, is that it's not just a gender gap, but the gender gap varies across people's incomes. In that, in lower income households, on the left side of my graph here, you have a much bigger gap in men and women's completion of mobility of care. And in the higher income household, that gap narrows quite a bit. I think it's important to note that even in those very high income households, women are still completing more mobility of care than men. However, that discrepancy is still smaller than in the low income households. So there's a real equity element to who does this travel as well, beyond just gender. And I'm sure in other ways too, we just need better data. There's also important implications when it comes to sustainability. Care trips seem to be done by car a lot. People do care trips by car more than they do work trips by car. People also are happy to walk for care trips, which is great. 10% of care trips are done by walking. But people really don't seem to use the bus or public transportation or cycling for care trips. You see even less use of those two modes when compared to work trips. I've already talked about cycling a lot. Sorry, I can't help it. It's one of my favorite topics. But I just want to draw attention a little bit more to that public transport finding. This chart here shows the gender gap in public transit use for mobility of care. And while we don't have a lot of public transit use for mobility of care across the board, we actually have quite a few people in that very low income category that do use the bus or the subway for mobility of care. So people are using it for care, especially women, especially low income women. But you have very low rates of public transit use for mobility of care in the medium to high income categories. So what does all of this mean? What's my big take homes here? My big take home is that mobility of care is really significant. In the Montreal case, it accounted for 28% of daily trips, and yet it is not explicitly captured in transportation surveys, and it is easy to not think of it as significant because of how badly we measure it. I use the Montreal example, and then I gave you a Toronto survey, but there's more and more research looking at mobility of care in across Europe and South America, and that 28% is actually pretty consistent. The most frequently you'll get between 25 and 35% of of trips being for mobility of care. I think in one example it was as low as like 15%, but generally we see it's kind of hitting that almost 1/3 mark of trips being for care, which is pretty big, and I think important to actually explicitly count and encounter. Uh, in part because it's just an important trip, so we should measure it well, but also because of the equity component that women, and in particular in the Montreal case, low-income women, are doing the bulk of this mobility of care. I also, as somebody who's interested in sustainability, I walk and bike and use transit for most of my trips. Um, we find that there might be important considerations for planning those systems for mobility of care because people really want to drive their cars for them. And I would argue it's because we don't design sustainable mobility options to make care travel easy. All right. I wanted to end on some actionable steps. Um, and I'm going to start off by thinking about actionable steps when it comes to mobility of care, just because we spent the most time on that topic. Um, and I want to start off with other research I've done on how there's implications to not measuring mobility of care well. There's implications to that data bias, and that is that we don't really plan for mobility of care in policy. I did a policy review recently where I focused on the Toronto Transit Commission, so the transit planning organization for the City of Toronto, the largest city in Canada. We carefully read over with some students all of the recent policies coming out of the TTC. We read 435 pages. And what we were looking for is whether or not mobility of care is ever mentioned. And what we found is that it's rarely directly considered. The default trip was the trip to work. And when I say was it mentioned, of course, I wasn't expecting the words mobility of care. It's a relatively recent term, but we were looking for words around grocery shopping, around escort, around children, around health. And those destinations and trips were mentioned far less frequently than the trip to work. Trip to work seems to be that default trip. And also, what was interesting is that those mentions of mobility of care trips were more common in recent years, but also in relation to two specific things, which is the COVID-19 pandemic and specialized services, for instance, services for seniors or people with disabilities. So we tend to think of this care trips as for specific events or for specific people, when I would argue that everybody completes care, and it is important and essential for all. I also think it's really important that we consider explicitly mobility of care in transport research and planning when it comes to our sustainable transport investments and when it comes to transport policy. I'm going to go on a little bit of a rant here. If there's any people like me who try to walk and cycle as much as and use the bus as much as they can, I think you'll notice that some of those trips are really hard to do using those modes. Maybe it's different where you're based, but I have a feeling Hamilton's not that different from Ohio. Um, these two pictures here are from two grocery stores that I go to frequently that are in, believe it or not, very walkable, bikeable, transit-friendly neighborhoods. Both of them are in areas where I could easily bike to them in terms of distance and even walk to them for the one on the left. If you look at the picture on the right of the metro, which is a big grocery chain here, you actually have relatively high density development right beside it. And yet it's a very car oriented space. It's very hard. And honestly, even if I had my Dutch mom who was getting me on a bike since I was a baby, I get kind of scared driving through these parking lots. Like it's quite unpleasant. And it's a big parking lot to get through to get to the grocery store. And you don't see it in these pictures, but both of these grocery stores are literally on bike paths, but there's still that barrier to actually get into that care destination. And I feel like this is a bit of a blind spot amongst my sustainable transportation planning friends who will plan for the bikeable city, but not plan for care trips specifically within them. Oh, right, as another rant, we do have bike parking at one of those grocery stores, not the other, but it's the terrible kind where you can only lock your front wheel and not the rest of your bike, and you put your groceries on it and it topples over. So this is another annoying rant for me to go on. But I think this experience probably resonates with a lot of you. It's just assumed that everybody's going to use their car for these care trips. Um, there's also the question of transport policy. There are lots of ways that we can make transit more friendly for mobility of care, and I just want to highlight two that already exist. I want to give the TTC a little bit of credit because I just told you all that the TTC doesn't consider care well, but they are a great agency and they are doing their best. One is transit fares. For instance, the TTC relatively, well, I say relatively, it's been a few years now, introduced a 2 hour transfer window. So through a 2 hour transfer window, that means you only pay when you get on. When you tap again, if it's within 2 hours, it's a free trip. This means that you're not economically hindering people who are exhibiting trip chaining behavior, and those people are often doing care tasks and are more frequently women. So that's a really important policy that can help make care trips at least less expensive for people who use public transit. Another policy they have at the TTC is that children under 12 ride for free. And that can again make it at least economically easier to do these care trips and to do this trip chaining. If you consider this, let's say you're on your way to work and you're dropping off your child. Before these policies were in place, you pay for two fares for you and your child. You drop off your child, and then you pay for a third fare to get to work. That's three fares, whereas now it would just be one, your single fare to get on with your child and then to get back on to get to work. And I think this is really important for anyone who completes care and trip chaining. They just happen to more frequently be women and low income women. And finally, there's so much to say on actionable items about all of the, and I know I jumped all over the place at the beginning, all of those different case studies around gender and mobility and how they matter in different transport modes. But I just want to highlight a few that are related to what I was talking about and have been consistently identified. When it comes to transit safety, think it's like literally in the 1970s, people were finding that lighting really helps people feel safe on public transit. And yet in 2025, I was recently at another conference on women and gender and transport planning, and the research is still finding how important lighting is. So that's something that is we've known for so long, and we still don't seem to have really great lighting in a lot of our public transit stations. Also, having people use transit more frequently, having eyes on the street can help people feel safer. You know, it's no longer desolate and quiet. If there's people around, you feel safer. Cycling safety is very important. I want all the cities to build out their infrastructure, make cycling a much safer way to get around. And we know that that will impact everyone, but it'll impact those with less cycling experiences more and less confidence, and that there are more women who experience that. And I also think we need a gendered lens in crash prevention. When it comes to public health measures, there's a clear gendered element in that men are dying far more, but there's also gendered considerations in crash testing to ensure that women don't die more when they're in a crash. And also, maybe a takeaway from this is that women are actually very good drivers. So let's stop pretending that they aren't. So in conclusion, I hope you found that interesting. I hope I've converted you and become gender and transport nerds like I am. My big takeaways in general, if you get anything out of this talk, I just hope you get out of it that transport planning, it's not neutral. It's not neutral in many ways, but today I focused in on how gender shapes aspects of transport experiences across lots of different transportation modes. Some of the key points that I highlighted were that these gender differences in travel behavior exist across different modes. Women bike less, they drive less, they walk more, they use transit more. Safety is very important for transit. It's a gendered experience as well, and that there are gendered impacts of crashes. And finally, my great hope is that you come out of this knowing that there are some biases in data collection practices. And in particular, you know what mobility of care is, and that it's poorly captured, but a very important trip for everyone, but especially women and low-income women. And as a final reminder, I think a lot of these differences are very social. These are not things that have to be the case. In fact, women do not have to do more household serving labor than men. There's nothing about the way you were born that makes you want to have to do that. These are social pressures that are tied to larger gender norms. And in many ways, that makes it harder to change. But in other ways, that gives me hope because it is very possible to have more equitable and gender mainstream transport planning. So, with that, I'd like to thank you again, and I'm very happy to answer any questions or hear any of your examples of how the TTS did or did not capture your trips well. And I've also left my email throughout if anyone wants to connect in that way afterwards. So thank you.
Okay, thank you, Leah. That was a great overview. I want to say that some of your rants resonate with me very strongly. I have cases in my life where there's a bike lane and then you want to go to the grocery store and you have to navigate this big parking lot where cars are coming in every direction, which really, if, to me, feels like the unsafest part
Yeah.
of the bike trip. We already have some great questions in the Q&A, so I'm going to turn it over to Kennedy pretty quickly. I just had one question, or maybe one or two quick questions. What you mentioned 70% of men are in fatal crashes when in driving, but those were people inside the car. What about vulnerable road users, the people walking and biking and using public transit? Do we see a gender difference there?
So I don't know. I know that last year at the TRB, we had a whole session on gendered and crashes, which is what inspired me to include this in there. And I know that in it, we had like the emerging researchers on the topic, and we didn't have at that point good data. But I don't know if since then, because it's been a whole year, if we know more about the gender differences. I think we find differences based on race, but I don't know if we find gender differences. On who gets hit. And I think that's, to me, as a sustainable transportation planner, an even more fascinating area of research. Um, so sorry, I can't answer that. I don't, but maybe somebody else can. And if not, we need to do more research in that area.
No, I totally agree. I've seen some
Or
of the
you
data.
might know. Yeah.
No, I don't. I mean, that's the point is that I know that there are, for example, income differences, there are
Hmm.
racial identity differences, but you
Hmm.
don't see anything on gender differences among vulnerable road users, at least nothing that I've seen, any major studies. So I think that is a big gap. Oh, one thing about public transit, there's a couple quick questions, and I'm going to turn it over to Kennedy. One thing is that, like, we have a debate here in Columbus about fare free. Would I mean,
Hmm.
it's maybe you could just comment on this. It feels to me that like fare free transit is a gender issue besides just a broader social equity issue, and also a way
Hmm.
to generate more ridership. Just what's your reaction to that? Is that part of the argument we should be making for fare free transit?
I think you can make that argument. We know that women use transit more than men, and we know that low income women tend to be quite transit reliant, and that can be a huge help for women. I think any improvement to public transit, you can argue is a gendered issue because women are such users of the transit system. And that's why it's always so surprising that it's not pitched that way. That like in the policy review, there's very little on gender when you're like, oh, but women actually use it more. Like the women are the bulk of TTC riders. So if you want to argue it as a gender equity issue, I fully support that.
Okay, I mean, I have a lot of questions here, but I'm going to turn it over to Kennedy, who can you know, field some of the audience questions because there's a bunch in the queue here. So take it away,
Sounds
Kennedy.
good.
Yeah, that was such an excellent presentation, by the way. Really
Thank
informative.
you.
We do have a few great questions in the Q&A, so I'm gonna ask one of them now. In your research, how did the types or destinations for mobility of care trips differ between countries and communities?
Um, well, do you mean how they're measured on the surveys or what trips people actually do?
I'm not sure. Brian Hill, if you want to clarify that
Can try to answer,
in the
I can try to answer
Q&A.
both. It really varies in terms of what trips are captured. It really varies from origin destination survey to origin and destination survey. So the Montreal example captured care better than the Toronto example, which is why I made you do the Toronto one because again, not to be mean to Toronto. So you could see just how poorly they can be captured. Sometimes they do capture, like escort trips are quite good at getting captured. Shopping out is always one category, though. I haven't found one. So if you know any, let me know where shopping's actually differentiated. And it is definitely not common practice anywhere in the world to try to think of this as one type of trip. It's considered lots of different trips, which make them seem less important than they are. In terms of how it varies from country to country, again, because we don't really have great data, it's not something we even capture to begin with. I don't really know whether, the escort trips for children are more important in like Canada versus Europe, because we just don't have the data yet. But maybe I'll be invited back in a few years, and by that point, everybody will be capturing mobility of care, and I'll be able to respond to that better.
Oh, that's great. Someone else asked, I'm wondering about whether transportation habits, i.e., transit user rates, for example, are as gendered for aging households. Does mobility of care for older households remain as gendered as households with minors? This seems important to consider as populations age, especially because older people are less likely to be able to drive. It's a great question.
That's a really good question. And I actually do quite a bit of research on age-friendly transport planning. And it's something that I've proposed studying. But again, there's like don't measure mobility of care. So we don't really know a lot beyond just the basics at this point. We know that having children makes a huge difference in how many care trips you make, as you can imagine. So when you go from no children in your household to one, you see a big boost in how many of the trips that are being made for care. When you go from one to two, you see a small boost, and then from two plus, it like doesn't really matter. You're doing loads of trips anyway. But we know less about what happens amongst older adults, and I think older adults are really fascinating because older adults is such a broad category, right? So you have lots of people who are 65 that are considered older adults and actually do a lot of care for their children and grandchildren. And then you have older adults who stop working, where their main trip is mobility of care because that trip to work is less important. And I think this is a big part of creating age-friendly cities because if you can't drive anymore and your main trip, the only essential trip when you don't work anymore is your trip for care, how do you get to those places if it is designed around the car? And yet we don't really plan for sustainable travel for care. So that's part of what motivates it too.
That's great. And Samuel, we actually have a talk this April that addresses this
Yeah.
topic specifically. But to your point, that's so true. And I think there was an initiative in Columbus recently trying to motivate older adults to start using public transit more. So it really is important in Columbus.
Yeah,
Yeah.
sorry, I'm like gonna go on because I love talking about age-friendly cities. I found in some of my research too that a lot of older adults wait too long to try transit, right? Once they can't drive anymore, they're like, okay, then I'll do transit. But at that point, it's kind of too hard to learn. Believe it or not, it's actually it's hard to drive. You have to go through a whole licensing program to be able to drive a car. But using transit also involves a lot of skill. My parents are rural and aging, and anytime they get on the bus with me, they're a bit like, wait, how does this work? Where am I going? And that skill is something that I really urge people to do when they're still driving and not at the point where they can't drive anymore. Because at that point, it's kind of hard to pick up. So yeah, we need more promotional things like that to encourage younger, older adults to get on the bus. Yeah, sorry, rant again.
Yeah. We may have time for just one more question. Someone asked, if you were a municipal planner or a legislative lobbyist, what elevator pitch would you give for creating legislation that requires multimodal pathways for new development? Also, in existing car-oriented developments, what would you think planners could do to have the biggest positive impact or change?
Oh, that's a really hard question for last. I mean, I think if I had a pitch with somebody who had power, I would argue that we need to redistribute our funding to, if you want people to travel sustainably, we need to stop funding car-oriented travel so well and start funding sustainable travel better. And that doesn't even get into any of the equity considerations or gender considerations that I just talked about. If I had to do a pitch that was specifically about mobility of care, I really think the first step is measuring it. I think we do not see how important it is until we measure it. And when we measure it, we will be better equipped to actually know how to plan for it. So there's two pitches, two separate pitches, my bigger picture one and my more specific one.
Harvey, what do you think? Do you think we have time for one more question or no?
A quick one would be good. Yeah.
Okay. We have another quick one from Brian Hill. Have you seen successful studies to impute mobility for care based on travel surveys?
Actually have not. We have an exciting moment here in Canada where we're making our first ever national household travel survey. And so I was very much involved in trying to convince them to have trips for mobility of care, but I wonder to what extent that will happen. One thing I've noticed is, a lot of transit agencies have actually been really responsive to this work. I met with the people behind Montreal's origin destination surveys, and I was making these arguments, and they were like, "We're totally on board." And then they were like, "What do we do?" So we went through how we could capture care trips better. And at the end, they were like, "Well, we can't just change our categories in our OD survey because we do longitudinal research." And I was like, that's true. But they're still not capturing a third of people's trips. And they were like, that's just such a big, like, bureaucratic, like, long-term thing. So they were like, well, maybe at least we can split up shopping for leisure and shopping for care. And you're like, I mean, that's a baby step, but that's a step. And to be fair, it's hard to have that big institutional change. So I'm trying to play my small role by at least getting little tidbits out, and at least people will know what mobility of care is, even in small ways. Friends of mine who are urban planners now, when they're putting in a shared bicycle system here in Hamilton, I'm like, so why is it on that side of the parking lot? Can we get a little closer to the entrance of the grocery store? Because we know that's an important destination. And even that kind of framing of thinking, I think is like surprisingly rare. They're like, oh, I didn't even think of that. I just assume no one's going to go to the grocery store. And you're like, no, no, they will. And what we found is they do. Like, it is an important destination. People who do bike are willing to bike to the grocery store if they could. So this is anecdotally though. More research is needed.
That's great.
Okay, I think we'll wrap up now. Thank you, Kennedy, and also thank you, Leah, for your very enlightening talk. I agree with you that the first step is awareness, and the second step is to start collecting data, and then we
Mm,
then we make progress once we get our hands around the problem. But the problem is persistent,
mm,
and I think yeah,
agree.
thank you very much for highlighting that during your talk today. Um, I want to say that this is the first in our series of Cities for All this semester. Our topic on our summer webinar topic on making cities more inclusive so they can be accessed and enjoyed by everyone. Our next talk is Friday, February 20th, also from 12 to 1 p.m. Eastern. And next month's talk is titled, What Are Child-Friendly Cities Like? Why do they matter and how do we build them? And our speaker will be Tim Gill, who's an independent scholar and also author of the book Urban Playground, How Child-Friendly Planning and Design Can Save Cities. So that will be a really interesting talk. That'll be Friday, February 20th. You can go to cura.osu.edu and look under outreach, upcoming events, and you can go ahead and register for that talk right now. Or better yet, sign up for our newsletter at cura.osu.edu. That way you'll never miss any of the highly interesting webinars and events that we have here at the Center for Urban and Regional Analysis at The Ohio State University. I also want to end by saying that for those of you who are local here in Columbus or can be local, On Tuesday, January 27th, we have a special live event. We're going to be joined here on the OSU campus in the Wexner Center for the Arts Theater by Sarah Goodyear and Doug Gordon from the acclaimed War on Cars podcast. And there we'll be discussing their new book, Life After Cars. And this will be an engaging live conversation that will explore the future of urban life and how transportation, housing, and climate advocacy intersect to create more livable, people-oriented cities. So if you go to cura.osu.edu and again, outreach upcoming events, you'll see a page for that and you can sign up for tickets and don't miss that opportunity to talk to Sarah Goodyear and Doug Gordon from the War on Cars. So with that, it's the top of the hour and we're done this time. And thank you all for joining us. And as always, take care out there. Thank you.